very warm good morning and namaste to all the medicos, the paramedics, and the supporting staff of this organization. Namaste. I am Dr. Pulin Kumar Gupta, Associate Professor of Medicine and in charge ART Center at Postgraduate Institute of Medical Education Research, Dr. RML Hospital, New Delhi, India. It's a tertiary care center managed by the Government of India, Ministry of Health and Family Welfare. We have a daily OPD of almost 2,500 patients, and we have an in-bed capacity of 1,600 patients. We provide treatment free of cost to all patients, regardless of their color, caste, religion. And so today, I would first like to thank the Omics Group for giving me an opportunity to present my research as an oral paper presentation. From a developing country, it's a privilege for me to present a presentation in front of so many astute nations. Thank you very much. So, we did a study on vitamin D levels in HIV-infected patients and its correlation with the severity of disease. By severity of disease, as Sir already said, it's the immunological pattern, the CD4 counts. So the presentation is like, as we can see, the vitamin D levels in AIDS patients. So first, let me tell you about the AIDS epidemic in India. The prevalence rate is almost 0.3%, much less than South Africa. But still, India has amongst the maximum number of HIV/AIDS patients in the world because of the total number of high population. By 2000, there were almost 2.5 lakhs new patients diagnosed in India, and this figure has gone down to 1.2 lakhs. This is a 50% reduction, and the effort goes to National AIDS Control Organization. What are the vulnerable groups? See, as I told you, we are from a developing country. So there are some states like Bihar, Uttar Pradesh, Jharkhand, where 30 to 40% of people are living below the poverty line. So what do? The majority bread earner, the male partner, comes to Delhi, Punjab, Maharashtra, earns their livelihood. But since sex is the basic demand of life, they go to prostitutes, and so the infection starts going on. This is the first major group which is most vulnerable to HIV/AIDS. In fact, 99% of infection in HIV/AIDS are heterosexual to prostitutes. A very low percent is injecting drug users. There are some parts of India like Northeast and Punjab where these are the type of HIV transmission we do see. Till date, opportunistic infections are the most common cause of mortality as well as morbidity in India. Tuberculosis are national disease. Tuberculosis is rampant in India, and amongst HIV/AIDS, not even a single person is devoid of having tuberculosis once in a lifetime. But what is happening right now with the advent of first line, second line, third line ART? What is going on? The people are living 25, 30, 35 years with this present illness. So now the trend is changing a bit. The people are not dying because of opportunistic infection. They will die because of atherosclerotic heart disease. They will die because of depression, dementia. They will die because of some cancers. They will die because of osteoarthritis, osteoporosis, frequent falls, fractures, multiple other illnesses apart from opportunistic infection. So this is the nice time to focus upon all these things. We should focus upon 10 years after what is going to happen. And this presentation is actually focusing upon that thing. So these are the recent trends like atherosclerotic diseases, complications of ART, metabolic syndrome, lipodystrophy, early onset of coronary artery disease. India, metabolic syndrome is a part of our blood and genes. We have cardiovascular events 10 years before than the Western population. And these complications, the cardiovascular events are seen 10 years earlier than the normal general population of India. So what is happening? 20 years before a Western population patient, they are having cardiovascular events, myocardial infarction. This is a big burden to the society also. What is the significance of vitamin D in health? The sources of vitamin D, 99% is direct sunlight, and some food like liver, fish, and some fortified foods contain vitamin D. The receptors of vitamin D, almost all the body cells have vitamin D receptors. What do we say at VDRs? But majorly, the vitamin D has an effect on skeletal system. Skeletal system, I mean to say the bones. Lack of vitamin D is known to cause osteoporosis. lack of vitamin D is known to cause myopathy. Then brain, prostate, colon and breast. These are four major organ system where deficiency of vitamin D has been directly linked to the onset of cancers. These, vitamin D receptors are present in all the body organs, but these are four major centers, four major organs where there's a definite data to state that the deficiency of vitamin D is known to cause cancers in these particular organ systems. Then immune cells. And so immune cells, HIV is human immunodeficiency virus. So this is one particular point where a lack of vitamin D in a HIV positive patient will have a huge impact upon this particular group of patient. Now the causes of vitamin D, advanced stage, geriatric patients are known to have low vitamin D levels. Then lack of sunlight, the pollution in India is growing up. So definitely what is happening, the sun rays are not able to cross that. That is why there is a lack of sunlight. India is a developing country. People are now going to offices. People are living a more sedentary lifestyle rather than the old farm-based lifestyle. So there is a lack of exposure. Then residents at higher altitude, dark skin pigmentation, which is common in India. Malnutrition, nothing to tell much about that. Malnutrition is quite common in India and in fact other developing countries also. Then obesity, as told, metabolic syndrome is quite common in India. We are people with central obesity. This is one factor which causes a lack of vitamin D levels. And medication, steroids, statin, anti-diabetic drugs. All these together lead to a deficiency of vitamin D in Indian patients. What's the vitamin D status in general population? In USA, 36% of males and 57% of females are seen to have hypovitaminosis D. But this figure is almost the double in Indians. Almost 60% of males and 75% of general non-HIV population in India are vitamin D deficient. So what's the role of vitamin D in immunity, specifically in HIV positive patients? It has an impact upon the innate and adaptive immunity. What happens when the patient is HIV infected, macrophages, their action is whenever an infection, most commonly tuberculosis, when the tuberculosis bacteria enters the body, the macrophages engulf them and try to control them. But if the adaptive immunity is low, this infection will be rampant. And the adaptive immunity, the innate immunity, is modulated to some extent by vitamin D, which controls almost 200 genes which have an effect on immunity levels. The effect, in patients who are vitamin D deficient, they have a low cathelicidin peptide, they have low IL-37, the human defensin T are low. So together, all these lead to decreased immunity in general population and specifically in HIV/AIDS patient. So this is briefly about vitamin D and HIV. In 1993, almost USA Kudley et al. Stated that 11% of people are vitamin D deficient. In Germany, 1999, Kohn stated that 45% of HIV positive patients are vitamin D deficient. The figure rose to 60% in USA 2011 and 66% 2012. But let me state my figures later on. So what are the causes of low vitamin D in HIV/AIDS patients? Similarly, like the old causes like medication, high altitude, dark skin pigmentation, malnutrition, age. But last but not the least, ART and HIV disease itself per se. HIV disease causes increased interferon levels, which decreases the level of vitamin D. Then the recurrent opportunistic infection have a effect on vitamin D. ART, we all know, NNRTIs, efavirenz, they decrease the level of vitamin D. So what's the effect of hypovitaminosis D in health in these particular group of patients? We have frequent increased osteoporosis, increased fractures. Depression and dementia is much more common than a normal population. Coronary artery disease, as we have already discussed, increased opportunistic infection. This is a circle. Opportunistic infection causes decreased vitamin D causes increased opportunistic infection. But who is the sufferer? The person with HIV infection. And anemia, of course. So the aim so far study was to study the status of vitamin D levels in HIV positive patient and to assess any correlation, if exists, between the vitamin D levels and CD4 counts and the type of ART. By CD4 count, we mean the stage and the severity of disease. It was a cross-sectional observational study done at a tertiary care center, that's the Postgraduate Institute of Medical Education Research, Dr. RML Hospital, situated in the central part of New Delhi, India. HIV patients with or without ART were taken, and almost 170 patients for a total time duration of 70 weeks were taken. The inclusion criteria, as we know, were documented HIV infection as per NACO guidelines. The exclusion criteria, any patient who was a type 2 diabetic, hypertension, patient of CKD, liver diseases, patients on any medications or vitamin D supplementation which can have an effect on vitamin D, all were excluded. And what were the definitions? These were as advised by Holic MF, that vitamin D deficiency is to be taken when the levels are less than 20 nanogram per milliliter, and 21 to 29 nanogram per milliliter were taken as vitamin D insufficient. So these are the observation and results. Now, this is the most depressing one. You just see 21 to 50 year age group, which is the major bread earner, which is the major working person. 99% of our patients are HIV infected, remain in this particular group. So this is the most notorious thing about this illness, that this is affecting the most working group of people in India. As you can see, 79 to 80% of our patients were male and 20% were female. This is according to the NACO guidelines also. 75% of our patients were on ART and 25% were ART-naive. This is some demographic data which is quite in concordance with the normal general population. Now, something new. 6% of our patients came to be hepatitis B positive. 1 patient was hepatitis C positive, and 7 were VDRL positive. Why I have presented this slide? This is away from vitamin D and HIV. Because patients who have hepatitis B, C or syphilis, if they are vitamin D deficient, the chances of fibrosis, cirrhosis, portal hypertension, the chances of dying are much, much faster if they are vitamin D deficient. So these are those vulnerable group which will not die of HIV or opportunistic infection. They will die of liver disease. So this is just to focus that these are some co-infections which are quite rampant in India. Now, we divided our patients into 3 groups, group A, B, C, according to the stage of disease or the severity of disease. A were taken as those patients who had a vitamin D levels less than 200, CD4 counts less than 200. B were those having a CD4 count between 200 to 350, that's the advanced disease. The previous one was a severe disease. And the third having a mild disease, having a CD4 count more than 350. As you can see, the patients in first group were 81, almost 50% patients. The mean CD4 count was 110 and the vitamin D was 10.43, deficient. In the next group, the mean CD4 count was quite high, 270 almost, and the vitamin D levels were almost 12. In the third group, the mean CD4 was 532 and the vitamin D levels were 12.2. What do we see? There is definitely a difference. As the CD4 count increases, the vitamin D levels are increasing, or reversely, as the vitamin D levels are increasing, the CD4 counts are increasing, though this difference is statistically not significant. I am not saying that I am absolutely true in saying that as the vitamin D levels increases, the CD4 count increases. Statistical significance is not there, but yes, we can infer one thing, that increasing vitamin D levels are associated with increasing CD4 levels or vice versa. So, as you can see, the patients in group A, almost 100% patient had hypovitaminosis D. In patients of group B, the advanced disease, almost 98 to 99% were hypovitaminosis D. And in the third group, there were some patients who had a bit of sufficient vitamin D. Now comes the figure. 93.5% of our patients are vitamin D deficient. This is epidemic. You know what is happening? A vitamin D deficiency epidemic is going on. We have to now look upon this thing. There are astute clinicians sitting here who can make a figure, who can make a presentation to WHO. Now we have to figure upon this thing. 93.5% are deficient. Almost 5% are insufficient, so 99% have hypovitaminosis D. Only 1% of people are having normal vitamin D level. So, is it a disease? No, this is an epidemic, this is a pandemic going around. The time is changing. The focus should not only upon HIV or opportunistic infection. Now we have to change the focus to the side things which are going slowly, 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 and probably we are missing them. So, making a difference between the males and females, as you can see, the males had a lower CD4 count as far as A, B, and C is concerned as compared to females. But here, the vitamin D is lesser in males, though their is more in males, though their CD4 count is low. Why is it happening? Because in India, the majority of communities in India are either Hindus and Muslims. Muslims wear burqas and Hindu females wear ghungats. Majority of most of their parts are covered and they do not go out of their house because of some social structure. So this is one problem. Even in spite of having good CD4 counts, the vitamin D are low in female patients. Probably we cannot make a change. It's a social stigma. It will take almost 15-20 years. But yes, this states that the females should be focused. In fact, all of my female patients came out to be vitamin D deficient. So the females should at least be focused, because these are those patients who actually in India never complain of ill health. It's a fact. So now coming to the difference between the non-vegetarians and vegetarians, Indians are most of the time, the majority of population is a vegetarian population. But as you can see, there's a definite difference between the CD4 count in Indian, CD4 counts and vitamin D levels in vegetarian versus non-vegetarian populations. Non-vegetarian have a better CD4 count, have a better vitamin D, and so a better calcium levels. So let us keep this thing apart, because I tell you these are some social problems, things need to be changed. But yes, definitely this is a fact that vegetarians have a lower vitamin D, lower calcium, and lower CD4 counts. Patients on ART and not on ART, patients on ART had a higher CD4 count expected. Their vitamin D was a bit higher than non-ART patients expected. In fact, some people will say, because it's a fact also that efavirenz decreases the level of vitamin D, but frankly speaking, I could not get any statistical significant correlation between ART and vitamin D levels. But what is happening? As you can see, patients on ART have a higher LDL, have a higher total cholesterol levels. So these are those group of patients who have more chances of getting coronary artery disease, myocardial infarctions, heart attacks, strokes. So a focus should be on these patients also. So in the end, I would like to discuss the presentation as well as some limitation. First of all, the limitation. According to the prevalence of HIV, the number of patients was quite good. But according to the prevalence of vitamin D deficiency and insufficiency, probably we need a much more number of patients. Since it was a cross-sectional observational study, I cannot state that vitamin D deficiency is associated with low CD4 counts, because we need a prospective study for that. But still, we can, to some extent, infer the same. Now, as far as low vitamin D and ART and CD4 is concerned, we could not get any statistically significant correlation between these two things. But yes, we could just see that as the vitamin D levels increase, the CD4 counts increase, or with the higher CD4 counts, the vitamin D levels are higher. Reverse causality cannot be proved like that, but we need to have some more big studies to implement or to discuss these things. Now, the consequences of low vitamin D in these group of patients, as we know that these are the patients who are, because of some social stigma, who do not go openly outside. So these are those group of patients who have more depression. Much has been discussed about the mental conditions of, in fact, in this conference, I was really enlightened to understand the mental conditions of HIV patient. So this is to be focused. Depression, suicidal tendencies, dementia, AIDS. HIV is a neurotropic virus. It affects the brain and spinal cord. So dementia, depression, this is to be focused. Apart from HIV, let us give some supplementation so that the disease can be stopped. And regarding the ART, there is no effect of ART on vitamin D levels. So from our side, this is a small study. We cannot say that this thing should be done, but probably we will need some more studies for vitamin D supplementation as a part of treatment. From my side, if 99% is the incidence of vitamin D deficiency and insufficiency, probably we do not even need a vitamin D testing. We just need vitamin D as a part of ART in all these patients. A cholecalciferol sachet or a daily supplementation should be made a part of ART as a treatment of HIV/AIDS center, because now we are thinking about coronary artery diseases, osteoporosis, fractures, dementias, cancers, because with the increasing advent of ART, with the increasing age living with HIV, people will not die of opportunistic infection. People will die of all these sedentary lifestyle related illnesses. With this, I would like to end. Thank you very much.